Hi everyone, welcome back to my YouTube channel. Today we are going to talk about blood disorders. Let's start our topic with introduction. Blood disorders are conditions that affect the component of blood, including red blood cells, white blood cells, platelets, or plasma proteins. Blood plays a vital role in oxygen transport, immunity, coagulation, and nutrient delivery. Abnormalities in composition or function can lead to serious health complications ranging from anemia to life-threatening clotting disorders. Composition of blood. Blood consists of red blood cells that carry oxygen through hemoglobin and also called as erythrocytes. It consists of white blood cells that is also called as leukocytes that fight infection and participate in immunity. It also includes platelets that are also called as thrombocytes that are involved in clot formation, and include plasma that contain water, electrolyte, protein, hormones, and nutrients. Classification of blood disorders. Blood disorders can be classified based on the affected component. There are disorders of red blood cells, disorders of white blood cells, disorders of platelets, and disorders of plasma protein and coagulation factors. First, we will talk about disorders of red blood cell. First is anemia, that is decrease in hemoglobin or RBC count. Second is iron deficiency anemia, that is due to low iron intake or chronic blood loss. Third is vitamin B12 or folate deficiency anemia, that lead to megaloblastic anemia. Fourth type is hemolytic anemia, that is because of premature destruction of red blood cells, and it can be inherited, for example sickle cell anemia, or it can be acquired. Fifth type of blood disorders is red blood disorder is aplastic anemia, that is when bone marrow fails to produce enough blood cells. Sixth is polycythemia, that is when excess RBC production is there, and it may be primary, for example polycythemia vera, or secondary to hypoxia. Now we will talk about disorders of white blood cell. First is leukopenia, that is decreased white blood cell count that increase infection risk. Second is leukocytosis, that is increased white blood cells count that is often due to infection or inflammation. Third is leukemia, that is cancer of blood forming tissue resulting in abnormal white blood cells proliferation. Fourth is lymphoma, that is when cancer affects lymphocytes leading to compromised immunity. Now we will talk about disorders of platelets. First is thrombocytopenia, that is low platelet count, and it causes bleeding and bruising. Its causes include autoimmune diseases, infections, and bone marrow disorders. Second type is thrombocythemia or thrombocytosis, that is when there is high platelet count that increase risk of clot formation. Now we will talk about disorders of plasma protein and coagulation factor. First is hemophilia, that is genetic disorder that cause deficiency of clotting factor and it lead to excessive bleeding. Second is von Willebrand disease, that is deficiency or dysfunction of von Willebrand factor that affect clot formation. Third is hypercoagulable state, that is increased tendency to form clots which can cause stroke, heart attack, and deep vein thrombosis. Causes of blood disorders. First is nutritional deficiencies that may include iron, vitamin B12, or folate deficiency. Second is genetic or inherited factors that are cause sickle cell anemia, thalassemia, or hemophilia. Third cause is bone marrow disorders that may cause leukemia, aplastic anemia, and myeloproliferative disorders. Fourth is infection that may be viral infection, bacterial or parasitic infection that affect blood cells. Fifth is autoimmune disorders, that is immune system attack blood cells. And sixth is environmental factors like radiations, toxins, chemicals affecting blood cell production. Clinical features include anemia, that is fatigue, pallor, shortness of breath, and weakness. Second feature is bleeding disorder that include easy bruising, prolonged bleeding, nosebleeds, and gum bleeding. Third is infection, that is frequent infection, fever, swollen lymph nodes. Fourth feature is clotting disorders that include swelling, pain, redness in limbs, risk of stroke or heart attack. Fifth is jaundice. That is yellowing of skin and eyes due to hemolytic anemia or liver involvement. Diagnosis of blood disorders. First is complete blood count that measures RBCs, WBCs, hemoglobin, hematocrit, and platelets. Second is peripheral blood smear that examines morphology of blood cells. Third is bone marrow biopsy that evaluates blood cell production. Fourth is coagulation test that includes PT, APTT, INR for clotting disorders. Fifth is iron, vitamin B12, and folate levels that detect nutritional deficiencies. Sixth is genetic tests that identify inherited disorders like sickle cell anemia and thalassemia. Treatment approaches. First is nutritional supplements that include iron, vitamin B12, and folate. Second treatment approach is through medication that include erythropoietin for anemia, chemotherapy for leukemia and lymphoma, and immunosuppressant for autoimmune blood disorders. Third treatment approach is blood transfusion, that is for severe anemia or blood loss. Fourth is bone marrow or stem cell transplant, that is for aplastic anemia or leukemia. Fifth is lifestyle adjustment that includes diet rich in essential nutrients, avoiding toxins, and managing chronic conditions. Prevention and health maintenance. Balanced diet with ions, vitamins, and proteins. First is vaccination to prevent infection affecting blood. Second is to regular health checkups for early detection of blood disorders. Third is genetic counseling for families with hereditary blood disorders. Fourth is to avoid exposure to toxins, radiation, and harmful chemicals. Conclusion of this lecture video. Blood disorders can significantly impact oxygen delivery, immunity, and hemostasis. Early diagnosis, proper treatment, and preventive measures are crucial to maintaining overall health. Understanding the types, causes, symptoms, and treatment options enable better patient care and management. And this was all about blood disorders. Hopefully you like the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.